So if you wake up and your joints are feeling, incredibly stiff, your first instinct is probably to blame the mileage.
Right, like a wear and tear thing?
Exactly, like a car's joints just slowly rusting from decades of use.
Yeah.
But if that stiffness actually persists for more than 30 minutes, you aren't dealing with structural wear and tear at all.
Yo, you're really not.
You're dealing with a cellular siege. So, welcome to today's deep dive. We are synthesizing some really fascinating insights from an educational script by rheumatologist Dr. Vishwa Prakash Tiwari. And our mission today is to look at rheumatoid arthritis, or RA, not just as some local joint pain, but as a systemic immune misfire.
Yeah, and understanding the difference between those two mechanisms is critical. I mean, with regular osteoarthritis, your cartilage is physically breaking down.
Right.
But with MARA, it's totally different. Your immune system is actively targeting the synovial membrane, which is the tissue lining your joints.
Okay, let's unpack this. Because Dr. Tiwari's distinction between local wear and systemic attack really reframes the whole disease. If standard arthritis is the car rusting, RA is more like a castle's defense system getting totally confused and, attacking its own walls.
That is a great way to put it. The immune system recruits all these inflammatory cells to the synovium. It gets thick, it overproduces fluid, and this is why it's so dangerous when patients just dismiss the swelling.
Yeah, they think it's just aging, right?
Exactly, or just weakness. They think, oh, I can just massage this away.
Wait, really? People try to massage it? Because usually rubbing a sore muscle makes sense.
It does for a muscle knot.
Yeah.
But rubbing an inflamed joint capsule is entirely counterproductive. It's actually one of the most damaging myths Dr. Tiwari points out.
Because the joint capsule is already just engorged with inflammatory cells, so applying deep physical pressure wouldn't even relieve tension. It seems like it would just agitate it more.
It absolutely does. I mean, massage increases local blood flow. So if that blood is carrying more rogue immune cells straight to an active battleground,
Oh, wow. So you're potentially accelerating the damage.
precisely, you're making it worse, not better.
So what does this all mean for you listening right now? How do you distinguish RA pain from normal morning grogginess?
Well, what's fascinating here is the specific red flag Dr. Tiwari highlights. It's all about the clock.
The 30-minute rule, right?
Exactly.
Yeah.
Waking up with groggy joints happens to everyone. But he draws a hard line at stiffness lasting longer than 30 minutes in areas like your fingers, wrists, knees.
Biologically, though, what is actually dictating that half-hour timeline? Why 30 minutes?
It's all about fluid dynamics. While you're sleeping, you're immobile, right? So that inflammatory fluid just pools and kind of gels up in the joints.
Oh, that sounds painful.
It is. And when you wake up, it literally takes physical time and mechanical movement to pump that thickened, cytokine-heavy fluid out of the joint spaces.
Right, through the lymphatic system.
Exactly.
So the 30-minute mark isn't just an arbitrary number. It's like the baseline time it physically takes for a compromised joint to flush out that overnight buildup.
Right. And we really have to remember that those inflammatory cells, they don't just stay trapped in the joint fluid.
Right, they travel through the bloodstream.
Yeah, which is why untreated RA suddenly becomes a massive systemic issue. It doesn't just strike hands and feet.
It's wild to think that chronic joint inflammation can actually accelerate cardiovascular disease just because those same immune complexes are circulating and, damaging the lining of your heart.
The heart, the blood vessels, the eyes, and the lungs. Dr. Tiwari explicitly warns about this systemic reach. Untreated RA is a full-body inflammatory condition.
Which is exactly why immediate intervention isn't just helpful, it's completely vital.
Non-negotiable, really.
Here's where it gets really interesting, though, because contrasting this scary prospect of permanent joint damage with modern medicine, it's actually really hopeful. We aren't just relying on basic painkillers anymore.
Far from it. If we connect this to the bigger picture, RA is highly treatable now. But you have to see a rheumatologist. The introduction of disease-modifying medicines and biologic therapies has completely changed the game.
How so? Because older drugs used to just sort of suppress the whole immune system, right?
Right, but biologics don't do that. They're engineered to target very specific proteins in the inflammatory cascade like TNF, or tumor necrosis factor.
So instead of just carpet bombing the immune system, they act more like signal jammers, intercepting the exact messages that tell the body to attack itself.
Exactly. And that targeted intervention is why an RA diagnosis isn't an automatic path to permanent disability anymore.
That's incredible.
Yeah, when you combine those with physiotherapy, dietary shifts, you can actually halt the structural damage to the bone and cartilage. But the key variable is time.
You have to act before the constant inflammation permanently erodes the joints. So wrapping this up for you, the underlying message is super clear. Pay attention to those early warning signals.
Definitely. Do not ignore persistent swelling.
And really watch out for that crucial 30-minute window of morning stiffness, because catching it early keeps you active and it literally protects your heart and lungs.
Absolutely.
But, it does leave us with a pretty provocative biological puzzle to think about.
Oh, yeah?
Yeah, I mean, if our highly evolved immune system can make such a profound error, literally attacking our own joints, what might that tell us about how modern environmental factors or chronic stress are, like, quietly confusing our body's internal defense system?
Oh, wow. That is a fascinating question.
It really makes you rethink how your body interacts with the environment. So keep an eye on the clock, listen to your joints, and don't wait for damage to happen before taking action. Thanks for joining this deep dive, and we'll catch you next time.